In this mini lecture, we'll examine language development and children with autism spectrum disorders. During early language development, or before the age of 2 or 3, children with autism spectrum disorder often show signs of developing differently from their typical peers. First, there is a delay in demonstrating a skill called joint attention. Joint attention is the ability to focus or attend to an object, person, or a task for a given amount of time in order to interact. We'll talk more about joint attention in a few weeks when we discuss play and social interactions. Some children with autism develop fewer vocalizations or nonverbal gestures in their early years. Some research has shown that children with autism spectrum disorders actually demonstrate a decline in some of their language skills around the age of 2 or 3. It's important to note that some children with high-functioning autism develop alongside their typical peers and hit the developmental milestones in terms of language development. Another thing to consider is right now there's not a lot of research on children with autism in early language development stages because autism was not diagnosed until the age of 3 until very recently. So much of the research that's currently being done is based on parent reports after children get a diagnosis. On this slide, you can see the elements that are required to develop competency in language and communication. If we start from the inner circle, first, in order to develop language, you need phonetics and phonology, which first starts with sounds and then moves on to developing phonemes, and then those phonemes are put together to make words, which is considered morphology. Next, our collection of words moves to phrases and sentences, which is known as syntax. Moving from syntax, phrases and sentences are put together to make meaning, which falls into semantics. And finally, putting those words and phrases into practice and in the context of a discussion is known as pragmatics. Pragmatics is also known as social skills. In the next slides, we'll talk about some of the differences that we see in some of these areas for children with autism spectrum disorders. When it comes to developing morphology and syntax skills, we can first start to see some of the differences appearing in social development in children with autism. Many times, children with autism mix up pronouns or struggle to form well-constructed sentences. This means that they may not apply the rules of grammar when speaking. Some of the possible explanations for this could be first echolalia. And echolalia is repeating things that were heard. So in this case, when something is repeated, it's not repeated in the appropriate context, so it's often missing its syntactical elements. Other explanations could be the lack of attention or cognitive development. It's important to note that linguistic productivity is often aligned to a child's level of intellectual functioning. With a child who has lower verbal skills, this can be improved with the use of assistive technology and AAC devices, which again we'll talk about later in the semester. Semantics, or the meaning-making aspect of developing language, varies across the spectrum. Some typical things that you may see for children with autism spectrum disorders is the use of idiosyncratic language. And this is the use of non-conventional words or phrases, or the replacement of words or phrases with things that are not so conventional. Something else that you may see is the invention of words used to describe certain feelings or experiences. This is something that is common, that is often decoded by very familiar speakers or familiar listeners, but unfamiliar listeners struggle to find meaning because of the non-conventional use of words or non-standard words. Pragmatics or social skills is an area that children with autism spectrum disorders consistently struggle in. They demonstrate difficulty in the areas of starting conversations, remaining on topic, making relevant comments to topics, using appropriate language for a given audience or speaker, leading conversations, and then terminating conversations. These deficits make it very difficult for children with autism to maintain relationships and socially engage with peers. There are various supports that can be put in place that can help with language development. Some of these supports we've already examined this semester, and others we'll look at in future weeks this semester. First, there are various ABA techniques. Additionally, discrete trial training, which you are very familiar with at this point in time in the semester, can be used to support language development. Picture exchange communication, or PECS, is something that we'll dive into with our next lecture this week. Pivotal response training and facilitated communication are two strategies that were presented in intervention assessment assignments by your peers. I recommend that you review them if you're interested in learning more about these techniques. Finally, the use of AAC, or augmentative and assistive communication systems, can be used to help support language development. We'll be looking at that next week so that you have a full understanding of AAC systems and how they're implemented.